The thyroid gland is a small butterfly-shaped organ in the front of your neck. Don't let its size fool you. It produces hormones like T4 and T3, essential for metabolism. These hormones act like fuel, controlling your body's engine. They impact energy, heart rate, temperature, weight, and brain function. When the thyroid works correctly, it keeps your body running smoothly. Problems can lead to hypothyroidism or hyperthyroidism affecting health. Understanding these conditions is crucial for nursing care and the NCLEX RN exam. Welcome, I am Nurse Miriam. Hypothyroidism occurs when the thyroid gland doesn't produce enough thyroid hormone. This is like having your engine low on fuel. It slows everything down. As a result, your metabolism slows down, leading to a wide range of symptoms. Several factors can cause hypothyroidism. The most common is Hashimoto's thyroiditis, an autoimmune disorder where your body mistakenly attacks and damages the thyroid gland. Other causes include iodine deficiency, which is essential for thyroid hormone production, certain medications that can interfere with thyroid hormone production, congenital hypothyroidism, where some babies are born with an underactive thyroid, and treatments for hyperthyroidism like radioactive iodine or surgery, which can sometimes lead to hypothyroidism. It's important to remember that hypothyroidism can affect anyone, but it's more common in women and people over 60. Early diagnosis and treatment are crucial to prevent complications. Recognizing the signs and symptoms of hypothyroidism is vital for early diagnosis and treatment. Because the condition slows down metabolism, most symptoms relate to this slowdown. Common symptoms include fatigue and sluggishness, where you may feel tired all the time, even with enough sleep. Weight gain, as slowed metabolism can lead to weight gain even with no changes in diet or exercise. Cold intolerance, where you may feel cold even in warm environments. Constipation, as slow digestion is a common symptom. Dry skin and hair, where the skin and hair may become dry and brittle due to decreased metabolism, and depression and mood swings, as hypothyroidism can affect mood and mental clarity. If you notice these symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment. Diagnosing hypothyroidism involves a physical examination and lab tests. The most common test is a blood test that measures the levels of thyroid-stimulating hormone, or TSH, and T4. Elevated TSH levels indicate that TSH is produced by the pituitary gland and tells the thyroid to produce more hormones. When thyroid hormone levels are low, TSH levels increase to try to stimulate the thyroid. Low T4 levels confirm the thyroid isn't producing enough thyroid hormone. NCLEX alert: myxedema coma. Myxedema coma is a rare but life-threatening complication of untreated hypothyroidism. It's characterized by extreme hypothyroidism, decreased mental status, hypothermia, and other serious symptoms. NCLEX essential. Nurses should be aware of the signs of myxedema coma and be prepared to provide emergency care. Monitoring vital signs, maintaining a patent airway, and providing respiratory support are crucial interventions. Accurate interpretation of lab results is essential for diagnosing hypothyroidism and initiating appropriate treatment. Section 5. Nursing care for hypothyroidism. Restarting the engine. The primary treatment for hypothyroidism is thyroid hormone replacement therapy, usually with a synthetic form of thyroxine called levothyroxine. Nursing interventions focus on medication administration. It's crucial to ensure accurate dosage and timing of levothyroxine. Patient education is also a key component. Nurses teach patients about the importance of lifelong medication adherence, potential side effects, and the need for regular monitoring. Monitoring for therapeutic response is another critical aspect. Nurses observe for improvements in symptoms and regularly monitor thyroid hormone levels. Promoting comfort is essential too. Nurses provide warm blankets for patients experiencing cold intolerance and encourage a high-fiber diet and adequate fluid intake to manage constipation. By providing comprehensive care and education, nurses play a vital role in helping patients manage hypothyroidism and live full and active lives. Section 6. Hyperthyroidism. The engine in overdrive. Hyperthyroidism is like having your engine stuck in overdrive. It occurs when the thyroid produces too much hormone, speeding up metabolism. Symptoms are often the opposite of hypothyroidism. The most common cause is Graves' disease, an autoimmune disorder. Early diagnosis and treatment are crucial to prevent complications. Section 7. Recognizing an overheating engine. Hyperthyroidism symptoms. Just as with hypothyroidism, recognizing the signs and symptoms of hyperthyroidism is crucial for early diagnosis and intervention. Because the condition speeds up metabolism, most symptoms are directly related to this increase. Common symptoms include unexplained weight loss, despite increased appetite, rapid heartbeat, or tachycardia, where the heart rate may be faster than normal, even at rest. Heat intolerance, where you may feel excessively warm and sweat more than usual. Anxiety and irritability, as hyperthyroidism can cause nervousness, restlessness, and difficulty concentrating. Tremors, where shaking hands or fingers are common, and changes in bowel habits, where you may experience more frequent bowel movements or diarrhea. If you notice these symptoms, it's essential to consult a healthcare professional for a proper diagnosis. Section 8. Lab tests and Thyroid Storm. The dangers of an overheating engine. Diagnosing hyperthyroidism involves a physical exam and lab tests. Blood tests measure TSH, T3, and T4 levels. Low TSH indicates high thyroid hormone levels. High T3 and T4 confirm overproduction. NCLEX alert Thyroid Storm. Thyroid Storm is a rare, life-threatening complication. It's a sudden, severe increase in thyroid hormones. Nurses must recognize signs like high fever and rapid heartbeat. Emergency treatment involves blocking hormone production and supportive care. Understanding lab values and complications is essential for safe nursing care. Section 9. Nursing care for hyperthyroidism. Cooling down the engine. Treatment for hyperthyroidism aims to reduce thyroid hormone production and manage symptoms. This may involve medications, radioactive iodine therapy, or surgery. Nursing interventions focus on medication administration, where you administer antithyroid medications as prescribed and monitor for side effects, monitoring vital signs, regularly assessing heart rate, blood pressure, and temperature, especially in patients with severe hyperthyroidism or at risk of thyroid storm, providing a calm environment, reducing stimulation, and creating a restful environment to minimize anxiety and promote comfort. Promoting comfort, providing cool compresses, and encouraging light clothing to manage heat intolerance, and patient education, teaching patients about their condition, treatment options, potential side effects of medications, and the importance of follow-up care. By understanding the complexities of hypothyroidism and providing compassionate, evidence-based care, nurses can significantly impact the lives of patients living with this condition. Please download your free copy of the Ultimate NCLEX Study Guide.